Welcome back to Lung Cancer Foundation of America's fourth annual World Lung Cancer Day social media takeover. We've learned so much today from the nation's leading lung cancer researchers and people who are living with lung cancer too.
It's been helpful, really, to hear from people. These are folks who've never smoked, were understandably shocked at their lung cancer diagnosis. We know anyone with lungs can get lung cancer, but it sure helps to hear about their journey, about their successes, and their advice.
But we also know many of you may be the caregiver for somebody with lung cancer. Our friend, Dr. Raymond Osarogiagbon, sat down recently with lung cancer patient Brandi Bryant to talk about some advice for caregivers.
Research has shown that caregivers often experience isolation and loneliness. What advice do you have for caregivers who are dedicated and the only ones to help with their loved one?
Yeah, caregiving is a tremendous burden which has been understudied. Caregivers oftentimes get ignored, left behind, and it's only now we're beginning to appreciate the fact that they suffer too. And yes, indeed, caregiving is a tireless, tiresome task. It's a sometimes thankless task, and it can be a lonely task, obviously emotionally taxing as well. And caregivers also have the challenge of sometimes having to provide economic support in the midst of a catastrophic illness for their loved one. So one of the things that we are saying is, number one, we need to pay more attention to caregivers and their struggles and their needs. We also need to communicate with them directly, help them understand what's going on, what's coming around the corner maybe, and also encourage them to seek support. Nobody deserves lung cancer, and certainly nobody deserves to feel alone in supporting a loved one with lung cancer. So we ask caregivers to find a network. There are all kinds of cancer support networks with people who have experienced the same thing in different phases. Some are survivors, caregivers of survivors. Some have the experience of what happened even when they lost their loved ones. That support network is there to be plugged into. We also encourage, especially African Americans, who sometimes want to bear a burden alone, and because of all the stigma and some of the nihilism that goes with lung cancer, don't feel comfortable sharing their burden with others. We actually strongly encourage that people share the load.
It's okay to admit that you're struggling.
Yes.
So yeah, that is great advice.
There can also be a great economic strain on caregivers. Dr. O suggests that if you're a caregiver, discuss your situation with your employers. He encourages you to talk to your employer's HR department, talk to your insurance provider, to talk to your clinicians. They are all trained to know about potential resources.
And this is another great reason to plug into caregiver or lung cancer patient groups, support groups, because chances are your situation is not completely unique. Sometimes just talking about what you're going through can be very helpful, and you can learn from others who've been down that road.
LCFA is a great resource. All you have to do is go to lcfamerica.org. You'll find all kinds of resources for yours and